Hello, welcome to Health Matters Today. I am your anchor Utabe Archibon. This is a program where we handle various health challenges and chart a way forward towards bringing solutions to every health problem. I am not doing this alone because I have with me in the studio Dr. Omorin Akpan. He is a senior registrar community medicine department from the University of Uyo Teaching Hospital, and today we'll be discussing on the topic HIV and AIDS. Dr. Omorin will let you know everything you must know about HIV and AIDS. It's been there, but it seems forgotten. So many persons seem to have forgotten about this menace, but it is very much around. That's why we deem it fit to ensure that you know what you should know about HIV, how to prevent it, and probably you're a victim, what to do to live long and maintain your normal health. You're welcome to our program today, Dr. Morin.
Thank you very much.
Please say hi to the viewers.
Hello, everyone. Happy to be here.
You're welcome to our studio. Good to have you. Dr. Umorin, today, like I said while I was introducing the program, we are handling HIV AIDS. So many persons already know about it, or they may have layman's knowledge about it, but why we brought you to the studio is to let them know the everything anybody should know about HIV and AIDS. It's been there, but for some years they've not really been news about HIV AIDS. So what should people know about HIV? What is it about? The dangers involved in it. You're welcome, sir, to the program.
All right, thank you very much, Utibe. Actually, HIV/AIDS still remains a very vital issue to discuss. We can never get tired of talking about it, and to show you how important it is, so much money is being invested in trying to control this problem globally. So, in a simple way, I'd just like to say that HIV infection is actually caused by a virus, the human immunodeficiency virus, which is actually an unusual virus because what it does, it doesn't cause a disease on its own, but rather it targets certain cells that offer protection in the body. We actually call them T cells. Okay. In fact, if I was going to be more specific, we refer to them as CD4 cells.
CD4
yes.
cells.
So the virus actually targets these cells, and when the virus targets these cells and starts to replicate, increase, it starts to, destroy these cells.
Doctor, let me interrupt you. These CD4 cells,
yes,
what do they do to the body?
No, they are actually forms of T cells, which are white blood cells, okay, which protect against infection, generally. So the virus actually focuses on these cells, reduces the numbers of these cells in the system and predisposes the person to all sorts of other infections which we call opportunistic infections. I think the number one you'll be talking about is tuberculosis, and various others. So
a victim with patients with HIV does not just end up with HIV. There are other.
Of course, even there are even cancers that they are also at risk of getting. So there are various infections and even some cancers as well.
Okay, doctor, what are the possible signs or symptoms that a victim you can see, a pointer that you see and knows that this person is actually HIV positive?
Okay, well, it's very important to note that most of the cases, of course, at the initial exposure, when the infection comes in, and that's why we encourage people to really actively try to test themselves, because at the initial phase, most of the time, there's just a short period of maybe a few weeks, maybe 1 to 2 weeks, where the person may just have a few non-specific symptoms. The kind of symptoms you have, a lot of people will just feel that they have malaria. And then those basic fever, maybe
Headache.
weakness, body pains may just phase out, and then the person has a long period we call a chronic latent period. So the person can be symptomless for so many years, and then as those so many years pass by, the person now starts getting to the point where his immunity has dropped so much, and then some other more severe symptoms start manifesting, like maybe he's passing watery stool regularly and having fever for long.
Doctor, before these more severe symptoms start manifesting,
Yes.
at that point where that victim is having, let's say, is coughing or other minor symptoms,
Yes, minor symptoms.
don't you think the person should visit a doctor
Yeah.
or get tested to know what treatment to take?
Yes, a lot of people, actually a lot of people, when they have these initial symptoms, they may be thinking of something else.
Like malaria, which you
Yes,
mentioned
but that's why, a lot of health workers now are conscious of something called, active case finding. So most of the times, the responsibility falls on us to suspect, have that high level of suspicion, and actually test them. Of course, some of them know that they have high risk behaviors, things that will predispose them to have HIV. So some of them already know that, okay, I have to do this test.
Okay, doctor, what are these things, the factors that can predispose one to HIV/AIDS?
Okay, so like I just said few seconds ago, it's actually more or less a behavioral thing. So you have to first consider the person's sexual behavior. So people with risky sexual behavior, maybe people with multiple sexual partners, people engaging in unprotected sex. You also have people who actually are called injection drug users, people who inject themselves and share those needles with others. You also have what we call mother-to-child transmission. So if a woman already is HIV positive and she doesn't actually pay attention to that, doesn't try to seek treatment, already she's likely going to pass it on to her unborn child, either through the pregnancy or through the delivery or even during breastfeeding. So, and then of course you can talk about other means like blood transfusion, which are not very common.
So if a pregnant mother is treated, who is infected with HIV, and she gets treated on time, there's every likelihood that the baby will live. The baby can come out without being infected.
Of course, we call it prevention of mother-to-child transmission. If the mother is very serious with her medications, she's tested, she's confirmed, she starts her treatment on time, there's what we call viral suppression. So viral suppression means that you are very adherent with the drugs. You take the drugs very seriously to the point that the virus is almost undetectable in the blood. So yes, it's possible the mother can actually prevent her child from getting it.
You've answered my next question, because I wanted to ask you how people get infected, the mode of transmission, which you have mentioned in sexual intercourse, having multiple sexual partners and other things. Doctor, what would you have to say about, let me say, women who go to the salon to make their hair, and unknown to them they come back being infected? They may not even know where they got this thing. What do you have to say about that?
Well, what I'm aware of is that most of the things that will put women at risk, at least, women do manicure, pedicure, they use some sharp instruments in the process, and of course any serious responsible salon now, in fact, I think the women actually do have their own blades. Okay, that's the ideal thing. For those who don't, the responsibility should lie with that salon to provide new blades and make sure that you're not recycling it to use for another person. So it also applies with the men as well. The barbing salon.
How about those tools are being sterilized?
Yes, so what I'm just saying is that is actually what is expected. Of course, we are hoping that the women are knowledgeable enough to know that if they go to the salon,
they should not share.
Yes, they should not share.
Okay, doctor. I think that's enough for especially the women because that brings me to my next question. Who is
Okay.
more susceptible, women, men, or children?
Well, I would say based on the spectrum, everybody is actually at risk now. We just talked about preventing it from mother to child during pregnancy. So if the woman somehow is not able to do what she needs to do, to prevent to actually prevent the infection from getting to her baby, the child already has that risk, and there's nothing he or she can do about it. But when you look at men and women, adult men and women, they have a choice. Once they're educated, their awareness is created. It's more of a behavioral thing, so they can decide. In fact, the risk is there for both female and male, in essence. Okay, so it just depends on how they respond to the messages,
All right.
regarding prevention of HIV.
The message of prevention is what? What's the core message?
Yeah, they
How
call
to prevent this
yes.
HIV and AIDS?
Yeah, the core message still remains the same. Actually, there's a mnemonic that makes it easy for people to remember. We call it the ABCs of prevention. So A is abstinence. Yeah, we just encourage. In fact, that is 100% sure protection from
Abstinence.
HIV. Yeah, just hold yourself, and then be faithful to one partner.
That's for the married people.
Yes, one. Well, yeah. Well, different people have how they would actually describe that. Yes.
Okay.
Because we're in an evolving world. And then C is correct and consistent use of the condoms. That's the barrier method.
You said the B is what?
Be faithful.
Be faithful.
Yes.
Okay, to
one
sexual partner.
Committed partner.
Or abstinence is the best solution. All right. We are talking about HIV/AIDS, and the program is Health Matters. We'll go for a short break to be back shortly. Please don't go away. Right, welcome back to your favorite health program. It is Health Matters, and today we are discussing on HIV and AIDS, possible solutions. If you're just joining us, Doctor is here doing justice to the topic. He has told us what HIV is and what AIDS is, and what we should do to prevent this ailment. You can live without this condition, so it behoves you to abstain. He said abstinence, and then being faithful to one's sexual partner, or correct and consistent use of condom. So you choose any option that is best for you, but for me, I think abstinence is the best answer. So let's move forward. Doctor, we are here again. What do you have to say about the effects of this health condition? Possible effects. If you are HIV victims, what are the effects? What would it lead to, and how long can the victim live for?
Okay, I would want to perhaps paraphrase your question to mean maybe the complications that can arise from someone who is infected and does not seek treatment. Yes, it could go so many ways that are not positive. Like I said, number one, the life expectancy is already going to be shortened, because within a few years, based on research, just roughly maybe around between 10 to 12 years, it's just enough time for the virus to bring down the immunity, and then the person becomes exposed to a host of infections, various chest infections. I mentioned tuberculosis as one of the commonest ones that we're dealing with now, and then a host of others caused by other organisms, even infections that even get to the brain. And then, like I said, the person is also at risk of even developing certain cancers, so, and then the next thing is death. The person,
that is if the victim is not taking his medication seriously.
Yes, if he's not taking his medication, he will surely deteriorate.
Are they treatment free?
Yes, they
what
are.
What are the treatment options?
the treatments are actually, we think, we are grateful. They're actually sponsored by, foreign partners. Actually, the PEPFAR program, through the USAID, the United States Agency for International Development, they are doing a lot of good work. The drugs are free because they are sponsored by these agencies. I know when the Trump administration came about, people were scared and there were rumors of drugs costing 200,000, 100,000, but I just want to confidently tell the public that it's not true.
Yeah, because we heard that the drug have been withdrawn from African countries.
Okay, no, not at all. Please, treatment is still ongoing, and I think our government is becoming a bit more conscious of the need to look inwards and improve what we have, and I think they're seriously working towards that. The State Agency for Control of AIDS has been working very hard. So yes, we still have drugs.
Alright, doctor, there are still drugs free for HIV patients, so you can do your part. Now, doctor, my next question is, recently there is it is rated that Akwa Ibom State is like the #1 state with the highest number of HIV cases. Doctor, how true is this? And if it is true, what do you think government can do to help? Are there things we are not doing right? Or is it about individuals' kind of lifestyle?
Okay, well, as at 2018, there was a large national survey that was carried out. And that survey revealed that, yes, Akwa Ibom had, among all the states, Akwa Ibom had the highest, I think it was 5.5%. So what that means is that out of 100 people, about 5 to 6 people are, living with HIV. So, but that is actually old data. That was as at 2018. There's actually a current effort to get recent data, and I'm aware that they are almost done with that, so we can actually know what the picture is. As at 2021 already, we still got some data that showed that likely that rate is reducing. A lot of work has been done from both our partners and even the state government through the State Agency for Control of AIDS. A lot of work has been done, and we are very positive that actually that figure is not likely going to be the same. It's going to be for the better.
It's going to be for the better because everything is all about individuals.
Yes.
Because governments may not do everything. The part of the government is to make the funds available and the drugs.
Okay, and to complete your question, actually, you asked about the factors. Yeah, there are a lot of driving factors. Number one, we still have poverty and unemployment as a problem. So a lot of our women, when it comes to transactional sex, I think they have very low bargaining power on how to protect themselves. You also have the issues, this sociocultural, perception that people have that this disease is a spiritual thing.
Okay.
It's not even physical. Yes. And then you also have issues of access to healthcare. There are some hard to reach areas in the state. So those people cannot really access where they can actually get tested and receive treatment. You also have the problem of traditional birth attendants. It's a major problem because a lot of our women, believe in them more. Yes, the government has made a lot of effort to train a lot of them that they can be on the same level, but for those of them who are yet to, comply with this training, some of the practices they carry out actually put our women at risk of infection. So these are just a few of the driving factors.
And doctor, how much of government presence is actually at the grassroots? Because like you mentioned,
yes,
so many women in the village, the rural areas, and cannot have access to these health facilities. They don't even know what HIV/AIDS is. They can't say what it is. So what can you say to the government to help improve the lot of the people at the rural areas?
Well, we are already we're in a low resource setting already. Some people will refer to us as a third world nation.
Yes, we are.
So we have lean resources. Government has their own part to play. I think to a large extent they have been trying. Okay, they be putting in a lot of effort. They've been cooperating with, their developmental and implementing partners, and a lot has actually been achieved. Okay, so but and I'm confident even the current governor, through his Arise initiative, through the State Agency for Control of AIDS, he actually seems to be giving more face to healthcare now. I've seen him put some square pegs in square holes, so we are
Yes, he's doing
confident
that
that,
a
yeah.
lot. But my concern is all these efforts the government is
Yes.
making, the modalities, do they get to the very people
No,
that
they
really need
they,
this
they
help?
they do. There's a lot of work that is really, ongoing, but it's a gradual thing. There's a target actually. There's a global target. It's called 95, 95, 95. Okay, so that target is given to all the member states of the United Nations that by 2030, 95% of the people that are living with HIV/AIDS should have been tested and confirmed. Okay, and that by that same 2030, 95% of those that have been confirmed should have been started on treatment and sustained on that treatment, and that also by that same 2030, 95% of those people that have started that treatment should be virally suppressed. Remember what I said about viral suppression. So government is doing its own part. Okay, there are other stakeholders too like us, but guess what, we may pass the message out there, but the people also have their own responsibility. They need to also see this as a problem. Okay, our traditional rulers, our religious leaders, they need to also, yes, they need to play their part, because the people also believe in them. So they need to see that this is serious. It shouldn't be looked down on. A lot of people just take it for granted. So I would say that government is actually putting in a lot of effort.
That's a good one. But doctor, is there a point where while you're taking the drugs for the patients now, you can suppress the virus, or it will be cured completely? Is there a point like that?
Okay, there is no known documented cure for HIV, but our drugs are effective enough to control the virus in the body, at least stop it from reproducing, replicating and all. So what we just emphasize is that when people start this treatment, they should be adherent to it. What that means is they should.
But at a point, people get tired of it. What advice do you have for those?
Well, yes. So it's
living on drugs. Morning, is it once a day or like twice a day?
Okay, let me give you the advice. The thing is this: we all know everybody values their life.
Of course.
The interesting thing, you asked me a question earlier which I actually didn't answer. You said that how long can they live? I want to tell you that if anybody takes their treatment serious, anybody living with HIV, they can live as long as even a normal person that is not infected. So now the thing is this: they should just take it this way, that the same way they know that they need to eat every day to survive. So those medications now are just part of their diet plan. They can take it that way. Okay, it becomes a part of them, and good enough. The kind of drugs we have now are not like drugs that we had in the past, that the side effects were really, really very disturbing. Okay, so that even encourages the compliance, so nobody really has an excuse. We have patients that have been faithful to their drugs for years and they are living very fine. In fact, like you said, when they are actually virally suppressed, because we have something we call discordant couples. So what that means is a man and a woman, they are partners, and one person is positive, one person is negative. So if that person achieves viral suppression, which can be achieved between 3 to 6 months, that by taking his drugs faithfully, it is even possible that there is a very small risk that he can even transmit the virus to his partner. So I'm just trying to answer your question. So that's what we are want to break the transmission.
All right, doctor. Okay. Thank you very much for coming. We hope to have you again whenever we put a call across. Thank you, and viewers, for staying through. This way we call it a day for this program today. Thank you very much for sharing your time with us. Ensure you take care of your health, because it's the healthy ones that will make the wealth. Have a good time.